really, really excited tonight. We have with us Dr. Krystal Tomei, who is out in not Cincinnati. You're out by Cleveland, correct? Cleveland, Ohio. Yeah, Cleveland, Ohio. And I usually have the presenters just kind of introduce themselves a little bit. So I guess I'm just going to kind of pass it over to you and have you introduce yourself and let us know how you got involved in Chiari and really your practice and all that.
Perfect. Well, hi, everyone. I want to thank everyone for joining tonight. I've been really excited about this, in part because I get to have a little fun myself. My name is Krystal Tomei. I'm a pediatric neurosurgeon in Cleveland, Ohio at Rainbow Babies and Children's Hospitals, part of University Hospitals. I got interested in Chiari malformations in part just through residency and treating patients and seeing the difference that you can make in treating them, and knowing that it is one of the more common things that we see in pediatric neurosurgery. And I just happened to very fortunately live in Cleveland and get connected with Kathy Posnick, who runs the local chapters and is very involved. And it's been such a great opportunity to really get more involved with Bobby Jones CSF. So I'm really excited to be able to talk a little bit today about Chiari malformations, and what my goal is to really make this something that the kids can watch and see, because I think that we answer all of the questions. And typically when I see patients with Chiaris, we talk to the parents and we talk about surgery and we talk about the risks and we talk about the complications and we talk about Chiaris. And I think sometimes it's really hard to really put that into tangible terms that our kids will understand, so that they understand what's going on with them and what's happening and why we're doing the tests that we're doing. So that was my goal. Caitlin, did you have anything else to say, or should I get started?
I actually think we should just get right into it, and then we'll take any questions that haven't already been answered like at the end. So I'm going to disappear and take it away.
Excellent. So I wanted to start with a little bit of an anatomy lesson. And to help me, we're going to call him Bob. Hello. So this is a skull. So as you can see, here are the eye sockets. That's where the nose is. There's the mouth. And at the very bottom of the skull, there's a hole right there. And this is the most important area that we're talking about with Chiari. So everything that we're going to talk about kind of centers around this little opening, and that's something called the foramen magnum. It's basically the opening at the bottom of the skull where the portion of the brain called the brainstem turns into the spinal cord and runs down into the spinal canal. So this guy sits on a spine just like that. Now inside, and Bob is really helpful to me because he lets me take off the top of his head. So this is the inside of the head. So I also have a brain here. And the brain sits just like that. So this top part of the brain is, the best way to explain it is, that's the thinking part of the brain. That's the part of the brain that gives you your speech and helps you move and helps you talk and helps you think. And then there are other parts of the brain that are just important as well. And they're towards the bottom of the brain. And this little part in the back, this green part right here, that's the cerebellum. So we'll talk a lot about this today. This is the part of the brain that for the most part helps you with your coordination and your balance, and moving all around and coordinating all of your movements. And then this part here, this little pink guy, this is the front of the brain. It's right in front of the cerebellum. That's the brainstem. Now this part's really important. It's kind of like one of the major control centers in the brain. There's different parts of it. This up here is called the midbrain. It's right kind of in the centermost part of your brain. This part here is the pons. This part here is the medulla. And then that turns into the spinal cord. So the bottom of the brainstem turns into the spinal cord, which runs all the way down your back. So these three parts of your brainstem control different things. Up here is some of your eye movements, and in the middle is some of your face, the sensation in your face and the nerves that run to your ears for hearing. And then down at the bottom here is the part that helps control some of the parts lower down in your head. So you're swallowing and you're breathing and the what controls how fast your heart beats, and what controls your blood pressure, which is how hard your blood is pumping, for the lack of a better way to explain that. And so that becomes very important down the line. The other thing to know about the brain is on the inside of the brain, there are little areas that make spinal fluid. Those are called ventricles. And you have one ventricle that runs on each side of the brain, like a little C shape that runs kind of around from the frontal lobe up here to the temporal lobe here. And then that goes into the middle part, which is the third ventricle. And then the spinal fluid flows down here in between the brainstem and the cerebellum, and then down at the bottom, and all the way around your spinal cord, and then back up. So that gives you a little idea of what the brain is shaped like and what the different parts of the brain do. And so I'm going to show you a little bit of picture, and then we're going to do some science experiments. And I don't know how many parents out there grew up with Mr. Wizard that had all of the science experiments. He was like my hero when I was a kid, and I used to play with him. So I'm going to do a little Mr. Wizard experiment. Some other people may have known like the next spinoff, which was Bill Nye the Science Guy. So these are the pictures. So this is the difference. This is the normal part, and this is just showing the bottom part of the brain. So the brainstem right here, and the cerebellum back here, and then the brainstem turns into the spinal cord. And this is like if you were looking right at the middle and kind of slicing you down the middle and looking from the side. So the front of the face and the back of the head. In a Chiari malformation, what that means is that the cerebellum, the bottom parts of the cerebellum are called tonsils. And those go into that opening at the bottom of the skull. So if you can see the difference between where that is, where everything sits above that opening, versus this below that opening, that's what a Chiari malformation is. And specifically, that's what a Chiari 1 malformation is. So most of what I'm going to be talking about today is a Chiari 1. So some of you may have heard that there's Chiari 1s and 2s and 3s and 4s and 1.5s and 0s. And it's important to understand that each of those numbers is completely different. So you don't go from a Chiari 1 to a Chiari 2 or a Chiari 2 to a Chiari 3. They're just different types of similar problems. So you don't change between them, and they're very, very different as far as how they can present. So predominantly what I'm going to be talking about is mostly Chiari 1 and Chiari 1.5, because those are both very similar. So with that, let's get to some little fun project art making. The way that I like to explain why Chiaris cause problems is that there's 3 different ways that it kind of causes problem. One, and we'll take this little measure. So this is my pretend brainstem. So I told you there were 3 parts. So this green part is that midbrain, and this black part is the pons, and this yellow part is the medulla. So if this glass right here, I'm gonna have to put this on a little bit of a shelf here so you can see. So if this glass is the spinal canal, so pretend you have a spinal cord that's going down. So the brainstem sits right at the top of that. Do you remember this opening at the bottom of the skull sits just like that over the spinal canal. So when you have the brain sitting on the spine, everything runs through that opening and down. So if that opening is the top of this glass, then one of the ways that the Chiari can cause problems is because normally the brainstem just sits like this, and there's plenty of room around it. And the spinal fluid is flowing all around it, and it doesn't cause any problems. But if you have a Chiari, the cerebellum normally sits back here. And if you have a Chiari and that cerebellum pushes in, do you see what's happening here to the front? It's getting pushed on that glass. So one of the things that can happen when something extra tries to squeeze down there is that it can cause symptoms because this part of the brainstem, which sits right near that edge, gets pushed forward. So like I showed in this picture, where those tonsils come down, it's squishing everything. So this part of the brainstem that gets squished, or the top of the spinal cord that gets squished, are the parts of the brainstem that control your swallowing and your heart rate. And those can cause symptoms like trouble with your swallowing or trouble with your heart and your blood pressure regulating themselves, which means sometimes people, when they stand too fast, they get lightheaded. And that happens pretty commonly to most people, but then sometimes that'll actually happen much more frequently to patients with Chiari malformations, and it's because this part of the brain is getting a little bit squished. Also, the spinal cord carries all of the nerves that go down to your arms and your legs, and when those nerves get pushed on, sometimes they don't act normally, and it can cause things to be a little bit off. So reflexes are more brisk. So when we tap your knee with the reflex hammer, it'll make your leg kick out a little bit faster. Sometimes it makes your balance a little bit wobbly because those things are all regulated by this. So that's one of the ways that Chiaris can become symptomatic. And sometimes people feel like they're just choking on food, or they're coughing, or they have a sip of water and they start feeling like it went down the wrong pipe. Those are common with Chiari malformations, and those are some of the symptoms that we see. So that's one of the ways that they can become symptomatic. Now, I'm going to have a little experiment here. I'm going to do this so I don't spill water all over myself. This is also why I'm not so dressed up today, because I didn't want to potentially get myself soaked with water as I do this. So I jerry-rigged these little glasses. So this is going to be your spinal canal, and this sandwich bag up here is going to be your skull that holds all the brain. And I'm also not very crafty. So I made a pretend spinal cord, and then just like I said, with these 3 different parts of the brainstem. So here's my spinal cord, and that matches up to those 3 different parts. So the midbrain, the pons, the medulla, and then this is the spinal cord down here. So if I put this down like it's sitting in a spine, and this is the normal back of the skull. So remember, we have a skull sitting like here. So if I take this skull away, you've got this little back part. So this is a normal cerebellum. So it looks kind of like a blob. That's true, because again, I'm not very crafty. This was the best that I could do to shape it. So if I put this in here, where the cerebellum normally sits, get a little stuck on this bag here. There we go. So that's where the cerebellum normally sits, in the back of the brain. So it's not going into that opening. So you see it's above the opening at the bottom of the glass. So it's sitting right there. So normally, spinal fluid is made in the brain. And this is where I hope that I don't spill everything everywhere, and why I have a nice little bucket to catch everything. So if the spinal fluid goes down the brain, it flows around and it fills the glass, because it can fit right through the normal pathways. So that flowed nice and smoothly into the glass. And that's what normally happens when you have the spinal fluid that's made in your brain and is trying to flow past that in the opening in the bottom. It just flows right in. But things have a problem if you have a Chiari. So here's our second experiment. So we have our another brainstem that's going to sit right there in our spinal cord that goes down. And this is our Chiari cerebellum. So you see these two little hangy things, those are the tonsils. So if I put that next to it, and those little tonsils are pushed into that opening. So now I'm going to try and do the same thing, and I'm going to try and pour water down this. Get this fixed a little bit. So now I've got water that I'm trying to pour down this glass. And you see how it's getting stuck in that bag, and it takes longer to get into the glass. It doesn't flow quite as smoothly. So the best way that I can explain this, and I'm sure plenty of you have been out on a hot summer day and enjoyed playing in the garden, and you have your hose, and then maybe one of your brothers or sisters walk by and you want to spray them really hard, and so you have the hose that just is spraying water nicely, and then you put your thumb on it and that water just shoots out everywhere. That's kind of what a Chiari does. It's kind of like putting your thumb over the hole of that hose, and the water that's going by has a harder time getting out. So that happens if you have fluid that's being made in your brain and it's constantly flowing by. If you have resistance where that water is trying to flow out and it's hard for that water to flow by, then little things that raise the pressure in your head, your body wants to push out some water to bring that pressure down, to push out some of that spinal fluid. But if you have a Chiari, that CSF, that spinal fluid, can't get pushed out as fast because it's like putting your thumb over the edge of that hose. And that's what can cause headaches, because when you do things like scream really loud or poop or cough, or you're running around and getting a lot of exercise or playing with your friends, all of those things raise the pressure in your head. And your body normally just pushes spinal fluid out and lowers that pressure back down, and that's fine. But if you have a Chiari, you can't do that quite as effectively. And so you end up feeling not good. So we'll do this experiment so I can explain that. So if this is a bag and there's an opening at the bottom of that bag, your brain normally has some fluid in it. So we've got some fluid in this bag, some water in there. So if I squeeze the bag and there's a little opening, can you see the drops coming out? The water wants to come out because I'm putting pressure on the bag. So just like that, when you have pressure that builds up in your head, some of that spinal fluid flows out. And if you can't push it out, then the pressure stays built up, and that can cause headaches. So that's the second way that Chiaris cause problems. Most of the headaches are in the back of the head because that's where the Chiari is. But you can have headaches anywhere from a buildup of pressure. So they can be up in the front, they can be on the top, they can be all around. A lot of times because there are so many different causes of headaches, we also want to make sure that the headaches are being brought on by things that are similar to what would bring on Chiari headaches. So that's why when you go to the doctor, they ask you if you get headaches when you poop, or when you cough, or when you're playing with your friends, or when you're running around, because those are all the questions that we want to know to see if those are the causes of your headaches that make sense with Chiaris. So now, our last little experiment. So here's my bag, and I have that hole in it. So remember that analogy that I used where I said the Chiari is kind of like putting your thumb over the edge of that hose. So if I have a bag with an opening and I pour some water in it, the water just flows through nice and freely. Kind of like if you have just a nice river that's flowing. Now if I take some stuff, and let's say I put something at the bottom of that. And then I throw some other rocks in there. So those are rocks in my river that was flowing freely. Now the water backs up a little bit, but you see it's also not flowing as nicely. The way that the water moves through the opening in the bag changes, and it changes everything about that downriver. So if you have a problem with the way that the spinal fluid is flowing through the opening in your neck, we talked about how that's all where the spinal fluid ends up is around your spinal cord. So just like if you had a nice flowing river and you threw a bunch of rocks in it, it causes a little bit of a rapid that forms in that river. And when that rapid forms, it changes everything down that river. So where you would be floating in a tube down a river nice and calmly, as soon as you have rapids in those rivers, then you start going up and down and around and bumping around. And when you have a change in the river upstream, you can have a change in everything else that spinal fluid flows around. So the last way that a Chiari can cause symptoms is by changing where the fluid is located. So normally the fluid is located outside of the spinal cord. But when you cause those rapids in the river, it sometimes pushes fluid into the spinal cord and makes a fluid space called a syrinx. So that's the Syringomyelia. That's the big word. It's basically just a buildup of spinal fluid in the center of the spinal cord. And that can cause pressure from the spinal cord on the inside out. When the nerves that run through the spinal cord get stretched, that can cause symptoms as well. And symptoms of a syrinx are anything from having funny feelings like tingling or feeling like your arms or legs are falling asleep and those pins and needles that you get, to causing a curve in your spine, something called scoliosis, to other impacts on the nerves like having pain that goes in your arms or your legs or around your chest or your belly. And that can happen from a syrinx. So that's why a Chiari becomes symptomatic. Usually one of those three things or a combination of those, but hopefully that gives you a little better idea of why things have problems and why the Chiari causes problems. Which brings us to, what do we need to do if we have to treat it? Well, this is a little tiny opening in the bottom of your skull. And if the problem is that there's too much stuff in this opening, like this is taking the whole space, then what we need to do is to make this opening bigger. So the way that we treat a Chiari is by making a little cut in this bone to make that opening at the bottom of the skull bigger, and then making a little cut in the first bone of the spine that's just like that, so that that ring of bone is open as well. And there's different ways and things that we can do beyond that. Some kids need to have their protective covering over the brain and their spine. That's something called the dura. Some kids, we open that and we sew in like a patch of material to make that bigger. Some kids, we leave that closed. And we're still learning why certain kids need certain types of surgeries. And we know why kids do better with certain types of surgeries, depending on the symptoms that they're having. So those are the different conversations that your neurosurgeon will have with you about why they're recommending the treatment that they're recommending. It doesn't mean that we have to treat every Chiari malformation. Some kids that I see have Chiari malformations and have no symptoms, and some kids have really bad symptoms. And we're still trying to learn exactly what makes some kids have much worse symptoms than others. For the most part, if the symptoms aren't having any problem or aren't causing any problems and there's no symptoms from the Chiari, we don't have to do anything about it. We just watch them. But for other kids, if it's causing symptoms and those symptoms are making it so you can't have fun, then we want to be able to do things that let you have fun again. So if you're always having a headache when you're playing and that's not really fun, then sometimes we need to treat the Chiari so you don't have a headache all the time. Some kids, if they're having trouble with their swallowing and every time they drink some water, it goes down the wrong pipe, then treating their Chiari can sometimes make that better. So those are the ways that we think about treating them. And then once you're treated, then we just watch you to make sure that no symptoms come up again. So with that, I think we have some questions. So I hope that gives you a little better of a visual sensation or a visual idea of what the different problems are and why the Chiaris cause problems over time. I'm learning that this stuff now is dyeing all this water, so I'm gonna pull that out so it doesn't continue to get red water everywhere. So Caitlin, do you want to come back on and maybe we can go through some of the questions? I think I saw a bunch that looks like they were asked for by kids, so I'm really excited about that, but I'm always happy to answer questions from parents as well. So we can just start going through those.
So I think I'm gonna start with some of the things that you've already kind of touched on. So a boy, he's 5, and he always asks why he's choking all the time, even though he's not eating anything. So I think it's really helpful to have a little bit of a visual. So maybe even what part of the brain is making that happen, and how does that happen?
So the part of the brain, I'm going to actually jump up real quick now that I have stains all over my hands.
Oh, I like your chair.
This is why I didn't dress up for this, and I clearly forgot in my armory of supplies, I forgot paper towels. So part of the reason why you're having trouble and why you sometimes feel like you're choking. So if you remember, we'll use this model because now my brain models are looking not so happy anymore now that they've been sitting in water. But if you remember, here's the front of your brain, and this is your brainstem. This is the bottom part of your brainstem, and that is what sits in that opening. So if you can see that brainstem come through the opening, if you can imagine this part of if that was being pushed forward and this part of your brainstem was being squished because too much stuff was in this opening, that's the part of your brainstem that helps you swallow right. So if that part's being squished and it's not working right, then you can't necessarily swallow right. And sometimes it gives you the feeling that you're choking on something or that you're coughing all the time because the nerve that helps you to swallow isn't working properly because it's being squished.
Okay. Then there's another really good question. A 6-year-old girl, she has Chiari 1. She was diagnosed just before she turned 4. And she always asks why her head hurts in different places. So she'll point to an area maybe above her ear. Sometimes it'll be on the top, sometimes on the lower parts of the head and the neck area. So how come the head can hurt in different areas?
Yeah. So mostly the Chiari, the problem is in the back of the head, back here. So the most common place that we think about is that area back there and having headaches in the back of your head, and you'll see kids grabbing back there. But you remember when I did that little demonstration and I had the bag and I squeezed on it, that pressure is all over the place. So if you had a balloon that was inflated and you squeezed on it, that pressure goes through the whole balloon. So sometimes you can feel it in different places. So it doesn't always have to be back here, because when you do things that cause the headaches, they go to all different places. There's also different causes of headaches, and some kids that have a Chiari malformation have headaches from other causes. So there are some types of headaches that you get from being really stressed out, and I'm sure there's a lot of people that are really stressed out with everything that's going on right now, because COVID is a very stressful situation. And you can get headaches because you haven't drank enough water and you're too dehydrated, or from watching TV for too long, or from needing glasses and having your eyes not be in focus and needing to focus better. So sometimes when kids have headaches in different places, there may be different headaches that are causing them, and sometimes they're all just from the Chiari because the pressure is just causing you to feel it in different places. So it's important, if you have headaches, to remember and kind of tell your mom or dad where your headaches are, because that can sometimes help when you go to see the doctor, for them to be able to know if these are headaches from your Chiari or if they need to look for other reasons that you may have headaches that they can treat a little bit better by telling you to drink more water or some Gatorade or avoid the heat or stop watching TV too close to bedtime or other things like that that can cause other types of headaches as well.
Yeah. There are a couple of questions from some kids asking about, I guess, focusing and memory. So sometimes school can be a little difficult. So does Chiari affect memory, and maybe they can't remember what they learned in school that day, or some days they're really, really good and some days they just can't focus? Is that something that is because of Chiari? Is there other things that might be causing it? How can they do better in school even?
So that's a really hard question. We used to really think that the cerebellum didn't do much from the standpoint of thinking, and it didn't really help with the thinking. It was mostly just it helps with your movement and your coordination. And as we learn more and more, we realize that the cerebellum is probably more important than we were giving it credit for. We know that if we look across at all of the kids that have Chiaris, a lot of them also have trouble in school and trouble with concentrating or trouble with learning new things. But we haven't exactly figured out if Chiari is the cause of that, or if there's something that causes both of those things, or if they're just completely unrelated. Certainly, we also want to make sure that part of the trouble with concentrating isn't because you have a headache all the time and it's really hard to concentrate with headaches. So those are some of the things that we think about. So we think that Chiari can sometimes happen and kids also have trouble in school, but we don't necessarily know that the Chiari is the reason that they're having trouble. So it's hard for us to say if treating the Chiari will make that better.
There's a really good question that just came in the chat since we're kind of talking about how kids feel. So a 5-year-old boy, he says that he has burning needles in his feet. Is that something that might be Chiari, or is what would cause something like that?
So it can be. When we have kids that we find a Chiari malformation, a lot of these can be found for different reasons. So some kids, we find them because they have symptoms that are very similar to Chiari symptoms, headaches in the back of their head or headaches when they're coughing. Some kids, we find them because they have funny feelings like those pins and needles that I was telling you about, and that's that fluid collection in the spinal cord, that syrinx, can cause those because it affects the nerves it most affects the nerves that give you sensation. So hot and cold, and the sensation of something poking you versus being soft. Those can all come from that syrinx. So sometimes if we hear that kids are having that, if they have a Chiari malformation, a lot of neurosurgeons will get a picture called an MRI of the entire spine to look for that, because that can sometimes explain those funny feelings that people say they have tingling in their feet, or their legs get really tired if they're walking. Some people will have kind of pain or shooting pain. Those are all very different, but those are different ways that a syrinx can present.
Okay. There's a really good question that came in sort of last minute. An 8-year-old boy, he had scoliosis, 30 degrees, and he had a syrinx in his spine. So they had a surgery. They had a Chiari external decompression, which you were talking about earlier with the dura. But it was about 5 weeks ago-ish. And now apparently he's having headaches that he didn't really have before, but they're about 2 to 3 times a day. They go away on their own, and they accompany, like, there are leg cramps, but again, they go away, and he's having a generally okay time. He's playing around the house, he's going to school virtually, and he does his PE class. Is there something that we should be concerned about? The mom's asking specifically, or is this just part of healing from the surgery?
So some of that, it's hard to say. You know, some kids heal a little bit different, and some kids, they get the surgery and most of their symptoms are better. In the kids that I treat where we find the syrinx and the Chiari because they have scoliosis, a lot of kids are screened for scoliosis, which is that curve in their spine at school, and then we just happen to find the the Chiari and the Syrinx because we're looking for reasons that they got scoliosis. Those kids, sometimes they don't have as many symptoms. The curve in their spine is the symptom that they were having. And those can have a little bit of changes. It's also common, you have a lot of muscles in the back of your neck. And so any parent out there, I'm sure you've heard of tension headaches when you're just stressed and you're bringing your shoulders up and everything is really tight and you get that pain that runs all the way up and then wraps around your head from tension. When we do the surgery, those same muscles that tense up when you're stressed get moved to the side for us to get to the back of the skull, because all of the muscles attach up here on the back of the skull. And when you move those muscles to the side and you put them back, muscles that have been injured cramp up. And so they can cause really bad cramps in the back of the neck. And so sometimes kids after surgery will get headaches because their muscles are really tight. So it's hard to say if this is something that's totally new or if this is something that may be a little bit common after surgery. I think it really is important for you to let your neurosurgeon know about these, because they want to know if there's any new symptoms, because sometimes that means that they need to get another picture and an MRI and just make sure that there's nothing going on. But some of my kids do have pain and headaches, and some of it is just from muscle tension. So it can be normal, but it also can be a sign that there's something going on with the Chiari and is worth looking at with a picture.
Yeah, and actually this is kind of making me think about it. We're talking about virtual school. Is there anything that maybe you would recommend for the kids that might be doing all of these classes hunched over like this, looking at a screen all day, particularly if they have Chiari? How can they kind of manage the inevitable headache that will probably bring on?
So that's really hard, because like I said, there are so many different causes of headaches. And unfortunately, a lot of kids have headaches from a lot of different causes, and it's not just one type of headache all the time. So if you have a Chiari and you get headaches, anything else that causes a headache just sort of piles right on top. It's basically just like this pig pile of headaches right on top of another. So things that you can do when you're stuck watching TV all day or watching a screen all day, it's helpful to be able to keep your head straight, because when you're in school, you're going between looking down and writing on your paper and then looking up at the board and looking back down and looking up. But when you're looking at a computer screen, you're just staring at one place the entire time. So sometimes it's nice, and we kind of recommend the same thing for people that are working from home. So adults that are working from home, take notes. So try and put your iPad or your tablet or your laptop at the same level, so that you're not constantly looking down or hunching down. So it lets you keep a little better posture and keeps those shoulders nice and relaxed. We all have a tendency when we're sitting there on a computer to do this and bring our elbows up, and those can just tighten all of those muscles in the shoulders and really contribute to different types of headaches that may not be from the Chiari, but certainly don't help if you already have headaches from your Chiari. So things like that, trying to make sure that the screen, you're looking straight ahead and you're not looking up or down at it when you're staring at one position for the whole time, can be a little bit helpful. And then just make sure you stretch it out. Do a little dance, a little shoulder jig, stretch it out. You know, nobody wants to sit in one place, and certainly when you're in school, you're getting up in between periods and moving around the classroom. So if you're standing there and you're just stuck staring at a screen for a while during virtual school, every once in a while, just stretch out your arms, shake them out a little bit. Just try and get those muscles so that they don't get super tight.
That's good. I gotta remember that, because so there is a question from a kid. Is it normal to feel dizzy or sick all the time, even when I'm not doing as much as my friends? How can I feel better?
Yeah. So that's another one of those things. So I'm going to bring back my little brainstem model, my little 3-part. So the midbrain, the pons, the medulla. This part down here, when it gets pushed, it can also sometimes cause that little feeling of dizziness. This area kind of right here is the area that controls kind of your sensation of spinning around. So like that feeling like when you are on a merry-go-round or something and you're spinning, or you're playing dizzy bat baseball and you spin yourself around and then you get up and everything still feels like it's spinning around you. That's down right in this area again. So that's the same place that can get pushed on with the Chiari. Sometimes getting the Chiari treated makes that feel a little better. There's also other causes of that. Some of those are just more heart related, where you feel like a little bit lightheaded, like you get a little lightheaded or dizzy when you stand up. So that can happen with Chiaris. Sometimes that's a reason that the Chiari needs to be treated. If the Chiari has already been treated, then sometimes it's just a matter of taking it a little bit easier and making sure that you pay attention to the symptoms that you're having.
That kind of leads into another question. So can I play all of the same games and sports as my friends? I know we get a lot of phone calls and kids are always asking, can they play different contact sports, soccer, football? What's safe for a kid with Chiari?
Yeah, so that's a really hard question to answer. We used to be really, really nervous about this. As soon as we found out that a kid had a Chiari, we didn't really want them doing a lot of stuff where they could get bumped or hurt, because we thought that they were just at a higher risk of getting hurt. But then we actually had some hospitals that did studies and looked back at kids that had Chiaris and said, well, hey, what have you done? And we think that when you've had a Chiari, you've had it pretty much your whole life. And a lot of these kids were out and playing sports and playing football and never had any problems. Every neurosurgeon's a little bit different with what they recommend, and some of that has to do with if you had a surgery, what type of surgery what type of surgery you've had. So certainly if you've had surgery for Chiari, the most important thing is to talk to your neurosurgeon about what's safe and what's not safe to do, and what sports are okay and what sports may be a little bit more concerning. For kids that I see, if they have a Chiari and they don't have any symptoms and I don't need to treat them, then I usually just talk about the things to look out for. I think the most important thing when it comes to playing games and playing sports and playing with your friends is to just make sure that you understand that if something doesn't feel right, you should probably tell your mom or dad. So if you're constantly playing games and getting headaches all the time, you should let them know. When you're running around, you start getting funny feelings in your arms or your legs, it's important to let them know. So I don't personally place a ton of restrictions. I love my patients do a lot of different sports if they've had Chiaris, as long as they haven't had a major surgery that I would be worried about. But it's just really important. What I tell everybody is all of the things to look out for. It's just really important that if that stuff starts happening, to pause what you're doing, stop, and make sure you let someone know.
Do you give any instruction, I guess, to kids that might have Chiari in your office? Like, is there a way that they can kind of track their symptoms? Does that help you? I guess, are there tips for doing that?
So probably the most common symptom that I see with kids who have Chiaris is a headache. And it's really important because what I talked about, the only way that we really have to treat Chiari malformations is a surgery. From a neurosurgeon standpoint, the only thing that I can do is surgery to treat it. So if I had to choose, if I was just having headaches and maybe they came on every couple months and it wasn't that big of a deal and I could take a Tylenol and be okay, I don't really think that I would pick a surgery to treat that. But if my headaches were every day and anytime I wanted to have fun and anytime I was playing with my friends, then that's a little bit of a different picture. So what I do recommend is if your child has a Chiari, to keep a headache diary. And what that involves is when the headache starts, where on the head is it located, what were they doing when the headache started, how long did it last, and did they need any medication? And then for kids who are able to give kind of a little more information, how bad is the headache? So for younger kids, that may be, is it a little headache, is it a medium headache, or is it a big headache? For older kids, they may be able to give you something like on a scale of 1 to 10, how bad is the headache? And that's really helpful for us because when we see these kids, certainly we don't want to rush everybody into surgery unless we think that it's going to make a big difference. And so if we have an idea of how often the headaches are happening, that's really helpful to us. If there are other symptoms that happen with the headaches, that's also important. If every time they get a headache, they also start getting some like numbness or tingling in their arms, Those types of things are also important for us to know. So if there's any symptoms that are tracking along with that, that can help us with our decision making.
Okay. Yeah, and I guess I'll go to this next then. This was a good question. Does surgery hurt? Well, obviously they don't have to have surgery, but what else can their doctors do to make them feel better? And does surgery hurt is probably a big one.
So I'll take that one first. So a lot of the kids that I see, if they're just having headaches, I will work with our neurologists. So there are two different types of doctors that work with the brains. There's neurosurgeons, which is what I am. And so I specialize in things with the brain and the spinal cord that need surgery to make better. The neurologists are really good at things that affect the brain and the spinal cord that don't need surgery. So they can look at different types of headaches. These are the same doctors that treat seizures, that treat cerebral palsy and muscle disorders and things like that. So those doctors I work very closely with for a lot of my kids that have headaches to see if their headaches are okay with just a medication. And so sometimes if the only symptom that you have is headaches and medication is enough, then that would be a reason that I would say, well, why don't we just try the medication? And if that stops working, then we can consider surgery. Most of us, if fluid collection in the spinal cord, that we don't think goes away on its own. And so that we do recommend different. But if the primary symptom is just headache, then there are some things that we can try to see if surgery isn't necessary. Does surgery hurt? Yes. So I wish that I could make surgery not hurt at all. And part of it is it feels like a big cut, but the bigger part isn't necessarily the cut. It's all those muscles that I have to move. The couple days after surgery, those muscles get really, really, really tight, and it's like a really bad cramp in your neck. And so that can be pretty painful. And a lot of the kids don't want to move because turning your head moves those muscles that just had surgery on them, and that doesn't feel very good. So when they want to look to their side, they do this, and they turn the other way. And some kids, after surgery, I usually recommend eating soft food because part of the way that your neck moves is this way when you swallow. And when you're trying to swallow something, I'll take a little drink of water. This is not the same water that I poured down. My head does this. So if your neck is really tight, it can sometimes feel like food is getting caught in there. So I usually recommend soft foods. So some people would say like mashed potato or mac and cheese. Personally, if you've had surgery, I think that you have the right to eat pudding and ice cream and popsicles and Jell-O, but that's just me. So that can be not very fun. So I usually tell my patients that when they come out of surgery, they're not going to like me very much. And then the next day, the muscles get really, really tight, and then they're not going to like me even more. And then the next day, I tell them that it's time to start getting out of bed and getting up and moving around. And then they really don't like me. And then from there on out, it starts getting a little bit better every day. And some kids will start being able to turn their head a little bit more and more. And then over time, those muscles relax a little bit. So surgery is not very fun. And this is probably one of the ones that I do that hurts a little bit more and takes a little bit longer to feel better from. And it's just because those muscles really cramp up. So usually by the time kids are coming back to see me a couple weeks after surgery, they're moving their neck. It still feels a little stiff, but it doesn't really hurt as much anymore. It just feels more tight than anything else.
About how long until they either feel back to normal or they can really move their neck and it doesn't hurt at all kind of deal?
Oh gosh, that's so different.
Yeah.
So it's really hard to say because I've had some patients that their headaches were just so bad that as soon as their headaches went away after surgery, they were just so happy that those headaches were gone, that the neck being stiff didn't bother them at all, and they were great. And I've had other patients that just really, some of it is just, it's scary to move your neck when it hurts, and so you don't move it, and then when the muscles just get really tense and tight, it becomes a little bit harder, and then they just feel really stiff for a while. I would say usually at 2 weeks, most people, it doesn't hurt, it just feels tight. It just feels like you need to stretch out a little bit, but it doesn't really hurt as much. Most kids, a couple more weeks are mostly back to themselves. By the time I see kids at like 3 months, most of them are back to themselves, but with better symptoms from not having a pressure on their brain anymore.
Actually, so are there any kind of stretches or little things that they can do maybe after surgery to make them feel better longer term?
So after surgery, what I usually recommend, and most of my kids, like I said, they'll kind of just, they don't want to move, so they just turn side to side like that. So what I recommend is, because everybody's just sitting around doing nothing, and let's be honest, there's a lot of TV watching going on. So I recommend every time a commercial comes on to do just a little bit of back and forth motion with their head and a little bit of up and down. And it doesn't have to be throwing your head back and forth, because it'll get a little bit easier every time. So just, the moms and dads out there, we lost our flexibility a long time ago, but if you stretch every day, you get a little bit more flexibility. So it's kind of like that. So just encouraging your kid to just do a little bit of movement every single day, and then you'll notice over time that movement gets a little bit easier and a little bit easier, and then they get back to normal motion.
Okay. There's a really good question in the chat. What are the causes of syrinx? Is it just Chiari, and what's the success rate of getting rid of the syrinx, I imagine, with the Chiari surgery?
So there are other causes of syrinx. So there are syrinx, the fluid collection in the spinal cord. Chiari is one of the most common causes. They can also be caused if you had an injury to your spinal cord. So we see them in patients that had spinal cord injuries or spine injuries. We see them in patients with tethered cords, which is where the bottom portion of their spinal cord, there's something that's kind of causing tension on the bottom of their spinal cord and pulling it down. And then we also see ones that are called idiopathic, like that's basically a big giant word that means we don't have a cause for it, it just appeared. For syrinxes that are associated with Chiari, so if we see a syrinx and we see a Chiari, most of us will say that the syrinx is from the Chiari, and we treat the Chiari to treat the syrinx. With that, there's a pretty good success rate. It varies depending on what study you read, but at about 80 to 90% of kids, their syrinx will get better or it won't get worse. We're finding with some research that there are certain types of Chiaris that are at more risk for getting worse after surgery, and those are conversations that your neurosurgeon will have with you, and a lot of it has to do with kind of things that we see on the MRI that give us a little bit of a clue.
So this one is interesting. I'm not sure what you say to kids when they come in. So what should they do if they're feeling scared? So they're having all these headaches and it's scaring them, or they are about to go into surgery and they're scared. Is there anything that you let them know, or something that they can do, people they can talk to?
So the first and very, very most important thing is that it's normal to be scared, because having a Chiari and having to have surgery for a Chiari is a really scary thing. And a lot of children's hospitals, in the realm of pediatrics, a lot of children's hospitals have extra services that help. They're called child life services. So they actually work, and they're used to working with kids of different ages. So for the parents out there, if your child is getting ready for surgery, those are things to ask about if the hospital has a child life program. These are specially trained people that understand child development, and so they have different ways to kind of talk to your child and interact with your child and understand why they're scared and see if they can do things to help. In our hospital, there's some things, so when you go to sleep for surgery, you get to breathe air through a little mask that you put over your face. And so we have stickers that you can decorate, and we have different, we get like little chapstick that smell funny, so you get to pick your smell. So you get to smell what you have when you're going to sleep. The most important thing though is not just that it's normal to be scared, but you're gonna be asleep when everything happens. So you're not gonna remember anything that happened. You're not gonna be awake during it. You go into a room, a surgery room, an operating room, and you go to sleep, and then you wake up and everything is done and your neck hurts. But you won't remember anything that happened. So you're not gonna feel any pain when it's happening. And then when you're waking up, you'll be in the room and there'll be nurses there, and your parents will be there. And there's gonna be a lot of different people around you that are constantly checking on you. So there's a lot of people that are watching you to make sure that you're okay afterwards. And understand that all that we care to do is make sure that you're safe. So that's really important to understand, because it's normal to be scared, but understand that everybody wants to keep you safe. And that's our goal through the entire thing.
That's really important. So I'm gonna give a last call for questions in the chat if we have any. And I'm gonna ask this one question that came in. It's not so kid specific, but it boils down to, how do we start the process of getting a diagnosis and treatment? So it can be really hard to get the correct diagnosis of Chiari. And in the meantime, while they're trying to find the right path, is there anything that maybe someone's parent can be doing to help relieve symptoms when they have a headache or any of their other issues? What can parents or friends and loved ones do to help that patient feel better while they go through this?
So some of the early stuff, if you're worried that your child has a Chiari and some of the symptoms that they're having sound like Chiari symptoms, then talking to your pediatrician about it is going to be the most important thing. Sometimes the pediatrician will be the one that will decide to get a picture, like an MRI, to look for a Chiari malformation. Sometimes they'll want to send you to a specialist, which may be a neurologist, because they see a lot of kids that have headaches, and they may be looking for that, depending on what it is. So some of the kids, if they present with scoliosis, they'll get referred to a neurosurgeon or an orthopedic surgeon that treats scoliosis. So sometimes it's those specialists that will look. It's important to kind of talk to your doctors and make sure that they know all of the symptoms that are going on. As far as what you can do to make your child feel better, it's a little bit hard, because as we're trying to figure out if it's a Chiari, a lot of what we do in headache treatment is really just trying to avoid things that bring the headache on. So if the headache is always coming on when they're jumping on a trampoline, then maybe we take a little break from a trampoline for a while we're trying to figure things out. But some of it, and if the symptoms are really from a headache standpoint, then keeping that headache diary can be really helpful to help you figure out what the causes of the headaches are, to see if there's certain things that you may be able to avoid to keep them from having bad headaches while you're waiting.
Yeah, that's really good. Okay, so I ask everyone this question. So how can people get in touch with you? I know in the era of COVID, people are doing a lot of second opinions, even seeing people remotely with telemedicine. So if a patient either wants a second opinion, or they just found a Chiari on their child's MRI, how can they get in touch with your offices?
So they can get in touch with my office. So there's a couple different ways. The easiest way is to call my office. My office number is 216-844-5741. So 216-844-5741. We also have on our website, they'll have the information for our offices. And so there's 2 pediatric neurosurgeons in my office, myself and Dr. Rothstein. There are also on the main University Hospitals of Cleveland website, I think there's a way to do a remote visit, but now that COVID has telemedicine, it's a little bit easier since telemedicine kind of blossomed with COVID to be able to do remote visits. So really calling the office is kind of the easiest way to get in touch.
Okay. And actually, this kind of makes me want to just ask one more question. So Chiari and coronavirus, is this, how can kids, I guess, prepare themselves? So it can be a lot to think about if you have Chiari and you're worried about Chiari symptoms, and then also worrying about COVID-19. So what have you been telling your patients? Is it safe to go into the office? Like how have they been preparing, and what have you been doing with that?
So as far as keeping everybody safe, and this is one of the things that our hospital has been prioritizing since the beginning of COVID, is to make sure that we can keep everybody safe when you come to see us, because just because this is going on doesn't mean that you shouldn't get care for the medical problems that you have. So for us, at least, everybody who comes into the clinic, we give them a mask at the front door if they don't have a regular mask, and we've actually switched so that it's all the hospital masks and not even the cloth masks anymore. So all of the doctors and nurses that you see are wearing masks, and we're all wearing goofy goggles. And then all of the patients are wearing masks as well. And they've found that if everybody is wearing a mask, the chance that anything could be transmitted is incredibly low. We also, all of the doctors and the nurses at the hospital get screened every single day for symptoms and for any fever or anything like that. And everybody who walks into our door gets screened as well. As far as if you do need a surgery, a lot of hospitals, I don't know if it's all of them because I obviously only know what mine and some of my friends' hospitals are doing, but we are testing everybody for COVID ahead of time, because we do know that even though kids may not have severe symptoms from COVID, putting them to sleep with anesthesia and a breathing tube can sometimes cause the symptoms to come in. So we want to make sure that we're not putting kids at any extra risk if they do have a positive COVID test. So we are testing every patient, but our priority, we're limiting visitors in the hospital, so we don't just have visitors coming in and out. So we're trying to keep the traffic in the hospital down so that we can still keep it a safe place for you to come and get care and have appointments and see your doctor in person. And if you're not comfortable with that and you want the comfort of being able to see and talk to your doctor at home, then we do have virtual visits so that you can see them at home. It's a little more limited because I can't really tap your knee and check your reflexes at home, and I can't check your strength when you're at home. But we can have good conversations, and I can do little things that help me get a general feel of if I need to bring a kid in sooner rather than later, so that I can do an in-person exam.
Yeah, and actually I don't know why, but I didn't even think of testing the patient before going to surgery. That's really a good thing to do, because who knows how this even affects anyone, kids included. So, but that's great. So, okay. So just to remind everyone, I'm going to add it to the transcript and everything, but what was the phone number for your office again?
So it's 216-844-5741. The other thing is, for all of you that are tuned in to this amazing Ask the Expert session, which is one of an amazing series that Bobby Jones CSF has put on, if you get in touch with any of the folks at Bobby Jones CSF, they all know how to get in touch with me as well. So it's always an easy way. But just a pitch for this organization and what this organization has done. There are so many groups out there that are just kind of formed by just the doctors or just the patients or just the families. And this is such a great organization that brings the doctors and the patients and their families and researchers all together to really figure out how to do a better job for our patients with Chiari malformation. And with the support groups that they have, it's nice to know that you or your child are not alone. And that you're not the only one going through this, and that there are other patients and families that have gone through the same thing. So I can't say enough for this community that Bobby Jones CSF has really brought together to bring us all together and to figure this out together. So
Thank you so
Still
much.
sick, but you guys have been wonderful, and I was really excited. I've literally been looking forward to this forever.
I know, I feel terrible. We were planning on doing this very hands-on where you could touch it, but I guess that will have to wait a while.
Coronavirus.
No worries. So I'm going to thank Dr. Krystal Tomei for doing this amazing session. It's been absolutely incredible. And I feel like we should probably do this again. But I also want to thank everyone for joining us. And someone said this session was great. So that's good. So thanks everyone for joining. And thank you, Dr. Tomei, for doing this for us. It was great.
Thanks for inviting me. This was a lot of fun. I don't even know what to do with the leftover of this stuff, but I'm sure I'm gonna figure out.
It kind of melted.
So I would assume my stress from now on.
Yeah, that's good. That's what I usually use it for. All right. Well, thanks
everyone.
Good night.